First of all, thanks Jennifer to bring us all together. There's very multi-talented people. I'm trained as a scientist, and I got my degree in UK and came to Rockefeller for a long time, 15 years. Came back to China 10 years ago. I'm going to talk to you about the scientific account of Zika. But I would like to introduce to you in a bigger account. The real issue I want to bring up is not just Zika itself, but also how much our world has changed, and also how disconnect our R&D development side and the public health side. So the real issue is how we could connect together to solve this problem in the most efficient manner. So the topic is, you could see it from the outbreak to R&D to global control. So we started, and then we need R&D, and we need a lot of policies and then the management to get it controlled. Over the last 100 years, we have achieved a great deal in many areas. One is vaccination, of course, tool of control infectious diseases through many efficient ways. But now, after maybe when the HIV was discovered in 1980, the whole world has changed. We have living in a very different world, so we have been facing different set of different challenges. Now, this is the Aviation Network that we see every day. I'm not sure how many of you know how many jumbo jets flying across the world per day. It is estimated 100,000 jets flying every day. If you estimate 100 passengers per plane, we have, 10 to the 7, 10 million people, right? No? 10 millions. And then through the last 50, 70 years, we studied the hotspots of emerging infectious disease around the world. You can see many of them in Africa, Central Africa, in China, and then some of them in Middle America, and then spreading to the rest of the world. So we are living in a very different world. And now, because of our economic development and also our humans' greed into many other areas, the ecosystem, we have been destroying it. All those pathogens supposed to live very happily with their own ecological environment, and now began to emerge into human, and then through the jumbo jets transfer into different parts of the world. But unfortunately, we are very complacent about the achievement we have made over the last 100 years. We became very ignorant about many of the infectious diseases. We still don't have a vaccine for HIV, TB, malaria, and many people involved in this field, we're still facing many challenges. We remain unprepared for emerging and re-emerging infections because we take chances. We know this thing's going to happen, but we don't put our efforts, put money, put efforts down. And then we're very arrogant about our capacity. We think we could handle it. But in fact, if anything comes, we'll be dead tomorrow. Imagine SARS outbreak in Beijing. I was there. Nobody in the street except the ambulance. 10 years afterwards, we still don't have a vaccine. We don't have a drugs. Think about it. We don't learn any lessons. So given this ever mobile society, we remain more vulnerable. We need a global model, because this is the biggest challenge everyone in the room is facing. So let's use this Zika to give you some of the scientific accounts, how that come about, and then where we are, and then how we should pursue from that point to control this disease more effectively. We all know this Zika virus is a mosquito vector transmitted diseases. It's very benign at the beginning, but causing microcephaly and many different neurological diseases. And then from the start, it was discovered in 1947 in the middle Uganda. And then through the years, the viruses have evolved, genetically evolved, and began to spread to the Southeast Asian country, Pacific Islands, and then in 2013, we have a big outbreak in French Peninsula. And then in 2014, when the Brazil holds its World Cup, football World Cup began to spread in the South American countries. So during that period, China, there's a lot of traveling between China and South American countries, and we have identified over 20, 30 people returned. So this is scientific account. The reason is because I personally experienced it, because we have a collaboration all around China hospital system, very different from the disease surveillance system. So when those guys arrive in Guangzhou in particular, we caught them, and then we diagnose them, we put them right into the hospital. So those are Chinese, but you could see the number of patients that we collected at airport. And then it's really thanks to the capacity building that China made over the last 10 years.
So in this slides, just for translation, we have the
cases, and then there are symptoms over the acute infection phase. And then you can see over the day, over their so-called disease symptom period, we observe them in different kind of diseases, symptoms, and then where they are, and then we isolate the viruses. That's how we do. We isolate virus, we study their immune system. Amazingly, compared to many other flaviviruses, Zika is very easily isolated from urine. Something is very distinct. Of course, we published a paper in Lancet Infectious Diseases, and then we follow this patient already 2 years, starting from 2016. And then, of course, we want to study viruses. We want to see how this virus is different from the African strain, from the Asian strains. We find the viruses transmitted to China very close to the South American strains, but those are called Asian strains because initially identified in Asia somewhere, right? With this genetic information in hand and with the virus in hand, we could do a lot of viral pathogen immunology studies. And then you can see what we do in the laboratory, in the hospital, to study how the viruses changes in patient samples. You can see very high level of viral RNA in the urine, very distinct. Those viruses, in fact, isolated from the urine samples. We also analyze their antibody response because antibodies are our intrinsic armory against different infectious diseases. If you are able to isolate a good antibody, you may use those for treatment, prevention, and then those antibodies will help us to design most effective vaccines. So this is what we do. So you can see antibodies. And then most importantly, now we have a very top-notch technology to isolate antibody from those patients, using from the patient bed, using the single cell isolation, get those antibody out and make them to study their antiviral effect. So you can see so many antibodies isolated from this single individual. And we find those persons develop antibodies later that really have good antibody response, potent neutralizing antibody response, that are able to kill the viruses. So this systematic biomedical studies are very, very important to understand their pathogenesis, disease progression, and identify the good antibody for treatments and therapy. So what we do then with this antibody, we put into animal models. And then we find their antiviral activity in vitro really correlate their protectivity in animal model. So when we put into one of those antibodies, really amazing. If you put them before the Zika viral challenge, it can help the animal 100% from infection and from microcephaly. So we published a paper in JCI Insight and also Cell Report. So it's a very good antibody. You can see that's what we have been doing. And most importantly, this is one of the beautiful pictures we have recently unpublished yet. And this, we already crystallized this virus and also antibody to see where this antibody is recognized on the surface. And then this red represents Zika, a live Zika virus. And then the yellow part is antibody that we isolate, most potent antibody. And then when you see it, it doesn't give you any structure. But if you see it again, it gives you very symmetric, very eye-close cathedral symmetry. That's really amazing. So you can see at the micro level. Do you see this 5-star in the air? You see that?
5-star.
That's 5-star. And this structure is very representative of five-fold symmetry. Because if you turn around 5 times, it doesn't. You wouldn't recognize its turn. And then you can also see around the circle, you have around this point, you have this circle, and that circle, and that circle, and then 5-fold. So it's at the micromolar level. at the minute level. This resolution of this is 11 angstrom. Angstrom is 10 to the 10th of meters. It's really micro level. You can see this beautiful viral structure. But our antibody is really amazing because that's can bind it and bind 180 copies, full coverage of this virus, make it ineffective against any of the neuron cells and other cells that are able to infect. But the problem for us, for those developing antibody vaccines, is how we can harness and streamline our efforts, be it from the social aspect and also medical aspect or regulatory, to facing this challenge for global health and security. We have the technology ready. We have almost everything ready, but it seems the linking, the piecing together is a big problem. If we don't solve that, I don't think we'll be healthy anymore. In particular, when this Zika and other infectious diseases come back again. So the point I want to raise is really we have a big gap, right? And then some of the area may not represent here, but we certainly have a big gap. But this big gap, we need to fill it. In particular, China has spent, over the years, this is a very up-to-date summary. Over the years, China has increased R&D investment, almost 20% per year. Now we are catching up the U.S. with $300 billion a year. And then China have playing bigger role, but still very fragmented. You know, we're sitting here talking about China-U.S. collaboration, but within China, we also need a connection. We need a link with our Zhongshan folks, with many other partners. And also China productivity in terms of scientific publications increased from 13% to 20%. But that doesn't mean anything. You know, paper is paper. You need to get people together to act. Otherwise, we will not be solving the major problem. So we certainly need a new model. The new model, what I'm referring to, new model is not a market-driven economy. It is a public health-driven collaboration. We also need to transcend from this so-called response. We have to proactively, instead of a response, we need to preemption. Okay? So with that, thank you for my team. Also, thank you for the hospitals, doctors in Guangzhou and in Shenzhen that we have been collaborating so well. And we are at the forefront, but we need a connection with all of you and the downstream development. With that, I'll stop my presentation. Thank you.
Thank you, Dr. Cheng.
Okay.
Actually, you mentioned that the Zika cases that was was caught by the surveillance system in Guangzhou.
Yes.
That's actually our next presentation. So it's all, as you can see, we are all connected. So next presentation by Dr. Stodo.
Even without rehearsal.
Even without rehearsal.
Right. And I'll also connect to everything we said about migration in the first session. So this is work that Jennifer and Rebecca and some of our colleagues, particularly in the Guangdong CDC, have been working on. It's based in large part on a presentation that we heard in Chinese when we were there in Guangzhou about a year ago, and we've been working with Jennifer's help to try to understand exactly what's going on. So please don't blame me if I don't have everything yet. We're going to work it out before we publish this. So I just want to make the point, first of all, that Guangdong stands at the frontier of the global battle between emerging infections. I'm going to be speaking about avian influenza, but of course Zika makes the point as well. It's a densely populated province. It has several very large cities, as well as Hong Kong that's physically adjacent to it. They have small side-by-side agriculture with large businesses and a very large GDP. Many of the small companies are there, or probably not so small. Many companies are there that some of the migrants that we spoke about in the last session are from other countries have come to work, including.
You show them, maybe help people to identify where it is. Hong Kong is right there, and Macau.
Macau is over here.
So that you can see the scale.
And Shenzhen is a giant city as well that didn't exist 30 years ago, or 35 years ago or something.
Village.
It was a fishing village.
Right.
Fishing,
I actually, that was my first trip to China, but that was all that I saw, the predecessor of Shenzhen. Now, the other thing, of course, is that this is the southern gate to China at the end of the maritime Silk Road, and everything that we heard about business and migrants goes along with that as well. And then furthermore, it has a tropical or subtropical climate. Different from the rest of China, people eat chickens more so than pork. And they like to eat them buy them from wet markets, where they can buy the live bird. And that is kind of a perfect setup to accelerate the development of new strains of influenza and pass them on to people. And it's no surprise that this region of the world is where most of the strains of new influenza have emerged over time. And so putting all this together with the trade and the migration and the geography and the population and so on, it's really a powder keg, we think, for the emergence of a new strain of influenza capable of starting a pandemic of global scale. So just the other thing by way of background I want to mention is the public health system that exists in China here. What this shows is the Chinese CDCs on the right, which don't really cover the whole range of CDC activities that we think, or public health activities that we think of in the country, but they really do a lot of work on the surveillance and detection and work in that sense. And they exist at 5 different levels, from national down to the very lowest level. There's also the National Health Commission work that exists in the same structures, and hospitals, from primary up to tertiary and probably more advanced than that at these levels. And this just shows the health infrastructure. It doesn't show agriculture and food safety and lots of other government organizations. What we know about preparedness is that you have to have what we call a whole of society approach. You have to get everybody to work together. And the fact that Huang has been able to do this, to sort of pull together all these different organizations, I think is quite impressive. So what have they done? 5 points I want to stress. The first thing is that they've set up a real-time surveillance system. The core of it is case-based surveillance, where they collect data from these local CDCs and hospitals and clinics, and have a web-based national database where data can be brought together and reports made and so on. It's a laboratory network of CDC and hospital labs corresponding to the structure I just showed you. They have a system for media surveillance, so they can monitor emails and WeChat and so on for in the media. And they've got a system of environmental surveillance that focuses on the poultry markets. This includes sampling before transportation and detection at both household farms and feeding farms at a larger scale. It involves the wholesale markets where they do cleaning and environmental detection. And they also have a policy, the 1110, where they call it the 3 1s policy, which involves 1 market disinfection per day, 1 thorough cleaning per week, 1 day per month when they close the whole market for cleaning, and 0 live birds that are held in the markets overnight. They also focus on monitoring people who work at the markets and come in contact with the poultry in other ways, because those are the ones, in a way, they're like sentinels that probably would be the first ones to show a new kind of influenza. Part 2 of the strategy is timely risk assessment and scientific evaluation. They've got a schedule for doing, these are a variety of different pathogens and conditions on a monthly basis, depending on the season of the year when you'd expect these things to be most common. Imported cases attention is needed throughout the year. And they do special risk assessments where they do rapid in-depth assessments and for disasters and things like avian influenza. And on the basis of this, develop tips for health for the public. Step 3 is rapid and effective response. They have a 4-level management strategy for, in particular, H7N9 avian influenza, one that we're focusing on and one that is probably the biggest current threat that we know about it. It's multi-sectoral and multi-level, reflecting that system, that structure I said before. One of the things we're still trying to understand exactly is how there are 4 levels, and whether you're at level 3 or 4 depends on available resources. Guangzhou and most of Guangdong province are at the control risk level. That involves disinfecting poultry cages and transportation vehicles, strengthening the management of wholesale markets, having a designated slaughterhouse, renovating live poultry markets, and strict implementation of the 3 1s policy. Shenzhen and Hong Kong are at the highest eliminate risk level, which includes stronger management of poultry farms, centralizing slaughterhouses and markets, strengthening the management of wholesale live poultry markets, closing live poultry markets in urban and rural areas, and relying on refrigerated fresh poultry products rather than live markets. And one thing I hope we can find out more is exactly what led to that distinction, why Shenzhen and Hong Kong got at that higher level, and what it would take for the rest of the province to get at that level. Does it reflect risk? Does it reflect resources? And so on. Step 4 is active and accurate intervention. This is a genetic analysis of some of the cases of H7N9 in Guangdong from 2015 that really showed that the transmission most likely resulted from local viral persistence rather than having the virus introduced from elsewhere, which had implications suggesting that live poultry market interventions by themselves can't completely control the situation. So in a way, it was like the presentation we just heard. You really need science to really understand what you're dealing with and have responses that make sense. And then 5 is multilateral communication within Chinese research networks, within international research networks, and they also have both an annual meeting and regular communications with the autonomous regions of Hong Kong and Macau, so they could understand what's going on and work together, because they all are in the same part of the world and have to deal with these threats. So what can we conclude from this? 1, because of its location, demography, and role in China's economic development, that this province, and Guangzhou in particular, are a powder keg for emerging infectious diseases. Their approach to surveillance and public health emergency response seems to be a model that other nations, and maybe other parts of China, can adopt, especially the comprehensive approach they've taken to surveillance and risk assessment, and the multi-sectoral risk management approach that they've developed. Now, given the complexity of the Chinese public health system and the fact that they have 2 autonomous regions that essentially within their borders, you have to imagine that whatever has happened, as good as it seems to have been, can't possibly be as good as possible. There have to be ways to improve. And I think that will be interesting to know, what are the troubles that they encountered along the way? What did they do to overcome those to get to the pretty good situation where they seem to be? And the other thing I just want to mention that I thought about when we were talking in the first session about migration is how much that plays into this in a number of different ways. One is, I already did mention the fact that there are lots of migrants there, which is a source of introduction of new pathogens, of course. But beyond that, if migrants don't have access to health care as much as other Chinese, will we in fact know about cases as soon as possible if we rely primarily on a case-based approach? Will migrants be blamed, be stigmatized, be discriminated against, as happens all around the world in infectious disease outbreaks? You can imagine that happening. I know we haven't seen any evidence of that happening in this particular case. But if it were a really bad a new strain of flu or something like SARS, something like that, you can imagine that happening. And then third is what it takes to deal with a pandemic like that is being able to communicate with the population about the need for vaccination or steps they can take to prevent infection. And if there aren't open communications open channels of communication that are based on trust, that's going to be really hard to do. And so I think that even though there's a lot of interesting, good work that's gone on, there are some challenges I think that need to be addressed. Okay.
Thank you.